All right, good afternoon, everybody. It is 2:30 p.m. on May 12th, and we're going to go ahead and get started with our public workshop. My name is Joseph Filippi. I serve as the policy manager within the Division of Consumer Health Services. Today, we're going to talk about a request for applications related to community-based organization, enrollment and education, facilitator grant opportunity. So before we get into the presentation today, because this is a public meeting, we do have to allow for general public comment today. So as included on the public notice, if you are wanting to provide just general public comment, you can do so by either raising your hand via the Teams platform, or if you're dialing in by phone, the phone number would be 775-321-6111. And when prompted, you would enter the meeting ID 825-802-123#. Anybody wishing to provide public comment today, feel free to raise your hand. You can press *5 if joining by phone as well. All right, not seeing any hands raised. I think we can go ahead and move on. Just as a quick reminder, please keep yourself muted. So moving on to the presentation today, we're going to go ahead and talk about our agenda. Again, my name is Joseph Filippi. I serve as the policy manager within the Division of Consumer Health Services within the Nevada Health Authority. With me today is Rosa Alejandre. She serves as our Navigator Program Manager for the Silver State Health Insurance Exchange, which is also within the Nevada Division of Consumer Health Services. So first we're going to do a quick overview of the grant funding opportunity and the associated timeline. We're going to then move into the role of an exchange enrollment facilitator, also known as an EEF, and the requirements associated with that. And then we'll move into the specific application requirements, and then also the scoring criteria and next steps for applicants. And then finally, we'll open it up for questions from anybody who'd like to ask questions related to the application process. Really, the purpose of this webinar is to provide anybody interested in applying with an opportunity to ask questions and gain a better understanding of the process. So today, we're excited to share a new funding opportunity created through the 2025 special legislative session. The Nevada legislature allocated $2 million to the Nevada Health Authority to strengthen education and enrollment assistance across the state. The goal of this grant program is to partner directly with trusted community-based organizations that are already serving Nevadans where they are. We know community partners are often the first place where people turn to when they need help understanding healthcare coverage options. This funding will support education and enrollment assistance related specifically to Nevada Medicaid, Nevada HealthLink, and also the Battle-Born State plans, which are Nevada's public option plans. This is about improving access, reducing confusion, and helping more Nevadans connect to affordable coverage. We especially want to reach out to communities that may face barriers to enrollment, including rural communities, underserved populations, and individuals transitioning between programs. Before we move on and get into more detail related to this funding opportunity, we just wanted to share a little bit more about who we are and what we do. The Nevada Health Authority was officially established last summer in July of 2025. The purpose of this new agency is to bring together key healthcare coverage programs under a more coordinated state structure. Our focus is improving access, accountability, efficiency, and long-term sustainability across Nevada's healthcare system. The Nevada Health Authority is centered around improving health outcomes while also delivering better value for Nevada residents and taxpayers. This new grant opportunity aligns directly with those goals because community-based enrollment assistance is critical to improving coverage and access overall. Within the Nevada Health Authority, the Division of Consumer Health Services brings together several consumer-facing programs. This includes Nevada HealthLink, also known as the Silver State Health Insurance Exchange, the Battle-Born State Plans, which are also known as our Public Option Program, And also, the division aims to improve health education and literacy efforts. The goal is to create a more connected experience for Nevadans seeking coverage or health resources. Rather than navigating multiple systems independently, we are working towards a more streamlined approach, and this funding opportunity supports organizations that can help bridge those systems directly within your local communities. A little bit more about Nevada Health Link. Nevada Health Link is Nevada's official health insurance marketplace. Nearly 100,000 Nevadans are currently enrolled through Nevada Health Link. It provides access to qualified health and dental plans from private insurance companies, carriers. Importantly, it is the only place where eligible Nevadans can receive federal financial assistance to lower monthly premiums and out-of-pocket costs. Many Nevadans qualify for financial help but may not realize it. Community organizations play a major role in helping individuals understand their eligibility options, compare plan options, complete enrollment, and maintain coverage. Nevada Health Link is especially important for individuals who do not have access to qualified employer coverage and are also not eligible for Medicaid or Medicare. The Battle-Born State Plans are Nevada's public option, and they're designed to increase access to affordable, high-quality coverage. These plans are required to meet premium reduction targets, helping make coverage more affordable over time. And the Battle-Born State Plans are available statewide, including in rural areas where plan options can sometimes be limited. Multiple carriers currently participate in offering these plans. One important role for the community partners will be helping consumers understand what Battle-Born State Plans are and how to identify them during the enrollment. As awareness grows, these plans can become an important affordability option for Nevada families. Moving on to Nevada Medicaid. Nevada Medicaid currently covers roughly 800,000 Nevadans. Medicaid serves a wide range of populations, including children, pregnant individuals, parents, adults without dependent children, seniors, and individuals with disabilities. Medicaid plays a critical role in Nevada's healthcare system, covering 1 in 2 births in the state, and also it covers 1 in every 4 Nevadans who are also receiving Medicaid coverage. Many eligible individuals still need assistance understanding the Medicaid application and renewal process. Community-based organizations are often best positioned to provide culturally competent, trusted, and accessible support to consumers. This grant opportunity is intended to strengthen those local connections and improve enrollment and retention efforts statewide. So finally, moving on to the funding opportunity itself, the Nevada Health Authority, we released the request for applications on May 1st, providing a deadline of May 22nd for applications to be submitted. As stated in the RFA, or the request for applications, the funding opportunity is seeking to increase exchange enrollment facilitator positions within community-based organizations to provide education and enrollment assistance related to Nevada Medicaid and Nevada Health Link, which also includes the Battle-Born State Plans and public option. We will share more about what the specific requirements are for these enrollment facilitator positions in the next couple slides. Additionally, there's up to $2 million of available funding to community-based organizations in this next fiscal year. All funds must be spent during the upcoming fiscal year, which starts on July 1st, 2026, and then ends on June 30th, 2027. I will note that final approval and distribution of the grant awards will be determined by the Nevada legislature, and those will be based on a Nevada Health Authority evaluation and scoring of the submitted applications. Moving on to the request for application timeline. So as stated, we released the request for applications on May 1st. Today on May 12th, we're holding the public workshop, and we appreciate all of you taking the time to learn more about this funding opportunity. Questions from applicants are due this Friday, May 15th. Substantive questions. We encourage organizations to submit questions early so we can provide as much clarity as possible during the process. Moving on to the 22nd, completed applications must be submitted by the 22nd. Oh, I did skip over one. On May 19th, Responses to the questions that were submitted will be posted publicly to our website so that all applicants have access to the same information. Application deadline is May 22nd, and then applications will then move into the review period between May 26th and June 1st, at which point recommendations will then be submitted to the Interim Finance Committee of the legislature. Their next meeting is on June 18th, and we are hopefully expecting them to be able to review and approve the grant awards during that meeting. Following IFC approval, notice of award announcements are anticipated to be sent out by June 25th, and then the grant period is expected to begin July 1st. We want to emphasize that all deadlines are firm and late submissions cannot be considered. Organizations should be gathering required materials now to avoid last-minute issues before the application deadline. I'm now going to turn it over to Rosa to go into a little bit more detail about what these enrollment and education facilitators do and their requirements.
Thank you, Joseph. So I'll go over briefly what an EEF is, which is an exchange enrollment facilitator or navigators, and what they do to help individuals. Basically, they help understand health coverage options, complete applications, and enroll people in coverage. They compare Medicaid, public option, and marketplace plans. They also make informed decisions about their health insurance with the consumer. They do not provide their own personal opinions, but these are unbiased opinions for the consumers, and the consumers make their choices. We want to make sure that they understand they will have a special emphasis, and it'll be placed on supporting uninsured and underinsured individuals, hard to reach and underserved communities. If we can go to the next page, please, Joseph, thank you. What are our desired outcomes with this new RFA? Well, we'd like to increase EEFs or navigators within Nevada community-based organizations to provide ongoing assistance to enroll and maintain Medicaid coverage or Nevada Health Link coverage, which includes obviously the Battle-Born state plans and all other plans, qualified health plans on the marketplace. We want them to understand and improve understanding and compliance with the new community engagement and work requirements for Medicaid, increase enrollment and continuous coverage. We'd like for also to reduce coverage losses due to procedural issues, strengthen consumer navigation and health insurance literacy. We want to expand access to in-person and culturally appropriate support. Thank you, Joseph. EEF prohibited activities. They cannot hold insurance-related licenses, producer, consultant, broker, or agent, cannot sell, solicit, or negotiate insurance. They cannot receive compensation from insurers or consumers tied to enrollments, cannot have financial or employment relationships with the insurance industry entities, including producers, brokers, consultants, or insurers. Should a broker, agent, producer, resident would like to become an EEF, they would have to sever their broker, producer, agent license and sever all commission lines that they have with the carriers. So it doesn't completely say that they cannot, but they would have to do certain steps if a broker would like to participate as an EEF. Next slide, please, Joseph. Thank you. And what consists out of EEF licensure or certification requirements? We have them listed here. They are in numerical order, but not necessarily that you have to take them in this way. But I'll go over them right here for you. First, they'll complete a 20-hour course, a pre-licensing EEF course through 80 Banker. It's a vendor through the DOI, the Division of Insurance. They'll also take an in-person state exam. They'll also have to complete the DOI license application, and they'll also have to submit through fingerprinting, which will go through an FBI background check. Once all those steps are completed, then they will notify us, and we at Nevada Health Link will issue them a link so that they can do an online training, which is called the Nevada Health Link certification. Once the EEF has completed all 5 steps, then that would basically allow them to become fully licensed and certified with SHICS and the Division of Insurance, and they can move forward with doing the work on their own. We will have any questions that you may have. We will have an email, which is at contactnavigatorsupport@nbha.nb.gov for more information. Should you guys have any questions about this or the other slides as they come in, even tomorrow or later today, once this webinar is over, please make sure you reach out to Navigator Support at nbha.nb.gov, and we will post your responses. Thank you, Joseph.
Thank you, Rosa. Moving on to the grant funding, the allowable use of funds. We want to provide clear guidance on how grant funds may be used so organizations can build realistic and compliant budgets. All funded costs must directly support Medicaid, Nevada HealthLink, or the Battle-Born State Plan enrollment and education activities. To focus on this funding, the focus of this funding is consumer education, enrollment assistance, and helping individuals maintain coverage. As stated in the RFA, there are different allowable cost categories. Allowable expenses include personnel costs for the EEF staff who are directly supporting grant activities. Also, fringe benefits associated with these positions are allowable. In-state travel related to the grant activities may be included. Organizations may also budget for supplies and operational materials needed to support the enrollment and education efforts. Indirect costs are allowable up to 10%, which is also identified in the RFA. And then also, under the other category, this could include the licensure and training related expenses, including those EEF certification costs that Rosa just went over. So right now, agencies are having to pay for those licensure and certification training costs. Through this grant, we're trying to allow coverage for those expenses to help bring your staff into compliance with these rules and regulations. Other examples of allowable costs, we covered, staff salaries for the enrollment assisters, education and enrollment materials, supplies, travel to rural or underserved communities. Again, expenses related to licensure, examinations, and certification fees, and also costs tied directly to any education and enrollment activities. When you're building these budgets, organizations should clearly connect the expenses back to the program goals and the consumer impact. There are a few key restrictions as noted in the RFA. There are pre-award costs are not allowable, so meaning expenses incurred before the grant start date. Out-of-state travel is not permitted under this funding opportunity. Costs are, and then any costs that are not directly tied to enrollment or education activities are not allowable. Compensation must remain reasonable and aligned with similar positions. And then indirect costs, as stated earlier, cannot exceed the 10% cap. We just want to, point out that the strongest applications will present budgets that are clear, reasonable, and directly connected to a measurable community impact and enrollment support activities. This funding opportunity is intentionally broad because we recognize that trusted community organizations come in many forms. Eligible applicants include nonprofits, governmental, and for-profit organizations that can meet the program requirements. We encourage applications from organizations that already have strong community relationships and experience serving Nevada residents. Examples of eligible organizations include, faith-based organizations, food banks, hospitals and clinics, federally qualified health centers, trade and professional associations, chambers of commerce and unions, small business administration, resource partners, community colleges, universities, school districts, tribal governments and tribal organizations, and also local human service agencies and health districts. We are looking for organizations that can effectively connect with consumers and help expand access to enrollment assistance and health coverage education. Organizations do not need to already operate a large enrollment program to apply, but you should be able to demonstrate community trust, operational capacity, a clear outreach strategy, a clear enrollment and education strategy, and the ability to comply with program requirements. All applicants must meet the federal and state eligibility requirements referenced within the RFA, including requirements related to exchange enrollment facilitators under Nevada law and regulation. This slide here is just giving kind of a checklist on what the required documents are to review during the application process. So the request for applications document includes an overview of the funding opportunity, eligibility requirements, and the timeline. Within that, there's an attachment A, which serves as the cover sheet. And then attachment B gives guidance related to what the project narrative should include. Attachment C gives guidance related to the budget narrative and the budget plan. In addition to that guidance document, there's a budget plan Excel template as well that we would like each agency to fill out when drafting your proposed budget. Attachment D includes the scoring matrix. So agencies don't have to fill that out. That scoring matrix is meant for members of the evaluation committee that will be reviewing all applications and scoring them. But having we wanted the applicants to have a copy of that scoring matrix just so they know what the Nevada Health Authority will be looking at when reviewing these applications. We would like you also to look over Appendix E and F, which have general conditions and assurances that we would need each agency to review, sign, and return to us along with their application. And then also Appendix F has some fiscal management checklists for you to review and confirm your agency meets certain requirements. Just want to remind everyone, please review all documents carefully and submit a complete application. Any incomplete applications may not be considered. Continuing with the application requirements, so a complete application will include the following: a cover sheet, which is signed, a project narrative or scope of work, which is a PDF, and then also a budget narrative, which would be a PDF, and then the Excel file, which would include the budget plan of the agency, as well as the signed general conditions and assurances document, and also the fiscal management checklist. All of these documents and guidance is on our website at nevadahealthlink.com. The grant opportunities page. You can click this link here. It's also included in the RFA document as well. Moving on to the application requirements, continuing that, I guess, the cover sheet, which also referred as attachment A. You need to complete all the fields listed, and there needs to be a signature included on that cover sheet. The project narrative, there's several sections of the project narrative. Attachment B goes into more detail, providing the guidance of what each project narrative should include. There's different sections of that narrative related to the organizational capacity and alignment with the grant funds, the service delivery plan, the community focus, performance metrics and reporting, and the staffing, training, and grant management capabilities. So just make sure it's really important that your project narrative touches on each of these areas and addresses the items listed in attachment B. As stated here, letters of support are encouraged. It's not required, but it would be helpful to have those as well if the agency is partnering with any agencies, or even if just to show, the support of the local community related to this agency. A key question to ask yourself, and what we're going to be looking for, is how will your organization offer direct in-person assistance with health coverage, enrollment, education? The budget narrative, it would be a document, a PDF document. It should explain how each requested cost supports the project scope and outcomes. Any personnel must include the base salary, the level of effort, and the months that will be charged, along with the role justification. Travel must follow GSA rates and show destination, number of trips, dates, and who is traveling, or at least an estimate of that. Other costs must be individually listed and tied to project objectives. There are several examples provided in the RFA opportunity within that guidance document on attachment C. An applicant should use the provided Excel template to complete the overall budget for this next fiscal year. The scoring criteria, so all applications will be scored based on the scoring matrix that's included in attachment D. The cover sheet is a pass or fail. So if we get an application with no cover sheet, that would be an automatic fail. So please ensure you include that with the signature. The project narrative is worth 85 points. So majority of the overall score will be related to what the agency provides in that project narrative. The budget narrative, along with the Excel budget plan, is worth a total of 15 points, with a total points available for each application, 100 points. So that's the end of the presentation. This slide here provides, the website where you'll find all of our RFA related documents, the email that Rosa shared earlier, navigator support at nvha.nv.gov. Please email that with any application questions so that we can get back to you as soon as possible. Again, we are compiling a list of questions that are asked along with answers that will be posted to our website later next week. So anybody that's wishing to ask some questions, I know we've had several in the chat that we'll try to go through, but feel free to also raise your hand and we will call upon you.
Do you want me to read through the ones in the chat, Joseph?
That'd be helpful, Katie. Thank you.
So the first one is, can you please clarify, is that $2 million across all providers, clinics in Nevada, not per provider group?
Correct. So the $2 million is the total amount of state funding available for this grant. So, we're not necessarily saying that we would award $2 million to a single entity. However, we're going to review all applications submitted equally and then determine, the total amount per grantee later on. Of course, anything that the Nevada Health Authority selects, we have to submit to the legislature for their review and approval. So ultimately, it's up to the Nevada legislature to determine the amount each awardee would receive. But so within each application, however you want to request the funds, it's up to $2 million. But we might have to divide that among several community organizations depending on the applications received. Hope that answers your question.
From Joan, our agency already has reps from DSS that visit our campus for this purpose. Will this continue?
Yes, I mean, this grant opportunity would not, change any services that are currently in existence. I think what we're aiming to do here is grow the number of assisters that are in community-based settings. And so we want to make sure that these enrollment assisters are both qualified to help with Nevada Medicaid enrollment and education, and also the qualified health plan enrollment and education related to Nevada Health Link or Battle-Born state plans. So I'm not sure if the DSS staff are helping with all of that or just Medicaid, but this grant opportunity is seeking to help with both.
I'll pass it over to Holly before we continue the chat questions. You can go ahead, Holly.
Thank you. I had a quick question about what happens after you receive an award. Are there certain requirements that are going to be, needed to know as far as fulfilling the partnership with the state in order to make sure that, either that gets put into the RFA or that we just plan accordingly internally for what that participation needs to look like? And I mean, like, in addition to what you've shared here, obviously assisting patients with making sure that they have the application process and the coverage, but are there any other requirements, say, around reporting or, participation in community events, things like that?
Great question, Holly. Thank you for flagging that. Yes, so there will be a monthly reporting requirement. We are envisioning a monthly request for reimbursement process. So we would expect any agency that's funded to provide us with a monthly report related to your program and the enrollment and education assistance you provided. Additionally, I believe it's outlined in the RFA that we want it kind of like a yearly report as well, kind of like a summary of all the efforts that the agency made over the last fiscal year. So monthly and annual reports will be required. In addition to your question related to activities, there will be, future training opportunities related to, upcoming Medicaid changes, specifically the community engagement and work-related requirements that will be coming into effect next year. So as those are being scheduled, we will expect that any, awarded agency ensure that their staff that they've hired as to serve in this capacity is attending those Nevada Health Authority trainings. And in addition to, completing the annual certification process for the Nevada Health Link.
Wonderful. Thank you for that. I want to make sure and let everybody else get their questions too.
Thanks, Holly.
Got a couple more for the chat, and we'll go back to the hands. My agency does not currently have this attached to our programming. Are these funds for agencies who already assist program participants with enrollment activities?
To answer that question, no. So this funding opportunity is open to really any community-based organization that would qualify. You do not have to already be providing enrollment and education services to be eligible for this funding opportunity.
Then let's see. Could we apply for a portion of the salary for someone who is already doing this work?
Rosa, do you want to take that?
Sure, Joseph. Yes, if someone is already doing this work, as long as they go through the licensing process as an EEF, and they remain doing this work, the minimum amount would be part-time 0.5 in order for them to receive some sort of salary reimbursement. Unless they want to do the grant 100% of the time, then they would dedicate 100% of their time to this grant, and their salary may be reimbursed completely 100%, again, depending on the reasonable salary that they're asking for.
And I do want to acknowledge we do see all the questions in here too about getting in a Word doc or different formats, so we will take care of those as well. But I will go ahead and pass it over to Gina.
Yes, I had a question about the determining that the salary is reasonable. Is that within your own organization, or are we talking about salaries for somebody who is a licensed EEF? And I was wondering how long we could fund a position.
I'll try to unpack that. I think when we're talking about reasonable salary, if there is an existing position already, in your agency providing these services, and then you're requesting funding that is not comparable to similar positions that are already providing these enrollment and education services, that would be a flag. We want it to be comparable to other enrollment facilitator similar positions. And the funding is available just for this next fiscal year as of now. So it would be starting July 1st, 2026 through June 30th, 2027. The state is looking to identify future opportunities to continue this funding. Nothing is set in stone right now. Anything would have to be, approved by the governor's office and ultimately the legislature. But as of right now, we do have funding through this next state fiscal year.
Joseph, next one is from Tracy. Can you have a sub-recipient?
We are not allowing sub-recipients for this funding. So we would want the agency that has awarded the funding to be the same agency that is hiring these staff to perform these services.
Okay, from Julie, we have been told multiple times that Medicaid does not have the bandwidth or any interest in having Medicaid assisters outside of Medicaid themselves, and that they do not intend to hold any classes or trainings to allow people to become assisters. Is that changing?
Yes, sorry if that has been communicated in the past. That is not, in my understanding, both from the legislature and from our state agency. You know, the whole point of this funding is due to the fact that we need more people to help with Medicaid education and enrollment assistance. And as stated previously, you know, community-based organizations are usually, you know, on the front lines as far as where people go to seek this support. So sorry if that was not communicated previously.
Hi, Joseph,
Hey
can I
there,
just jump in
Joseph,
right here
I'm
really
gonna
quick?
jump in, Rosa.
Yeah.
Thank you. So thank you so much, but this is Jennifer Krupp too. I just also wanted to clarify that this funding opportunity is being offered through the Division of Consumer Health Services. So I just want to make it really clear that we're not speaking for Medicaid. And that, you know, while we are here to help support Medicaid enrollment with these grant funds, we're not speaking on behalf of Medicaid. So in terms of being told, you know, that there's some challenges with bandwidth or having Medicaid assisters outside of Medicaid themselves, I do want to emphasize that this is a different program. And as Joseph had said, like, you know, that's unfortunate that maybe that may be what somebody has heard, but we are separate and we are a separate program. We work in partnership with Medicaid, but we are a different division within the Nevada Health Authority.
Thank you, Jennifer. I'll do one more for the chat and then I will go over to Nick. Let's see. The certification process for an EEF requires 20 hours of pre-licensing education and a state exam. Does the grant budget allow for reimbursement of staff time spent in training before they are officially certified?
This is Joseph. Yes, to answer your question, yes. Of course, this would have to occur after the grant period starts, so after July 1st. But yes, we understand that, you know, there's time, you know, you have to hire a person, they have to then go through the pre-licensure training requirements, etc. They have to take the state exam. We know that takes time. So, but if anyone who is hired for this purpose those expenses would be eligible for reimbursement.
And I'll pass it over to Nick.
Nick Ball, you're muted.
We'll go
Can you hear
over
me
to-
now? Can you hear me now?
Sorry.
Yes, we can.
Okay. I was just wondering, it seems like this is a program that it got sent out, at least for me, running a financial planning and helping with health insurance and things like that. But it's like to participate is not necessarily in that field. I guess I'm trying to like, because we sort of already do that, right? And so I'm like trying to navigate. Obviously, we don't get compensated currently, but to like, I don't understand where the line is drawn to assist, but yet say, yeah, I'm not doing any of that, but there would maybe be compensation, or if I hired somebody to fully facilitate that EEF position. I don't know if that sort of makes sense. There's sort of like a divide, and I'm trying to understand who it's trying to target to work. It's specifically, yeah, you're only going to do this and not really health insurance. You don't get contracted with them. Don't worry about that. Just guide them, consumer driven guidance.
Rosa, do you want to take that? I think I'm trying to
Yeah.
understand the question, Nick.
Hi, Nick, it's Rosie. Let me just make sure I also understood the question. When you say to assist but not really do the insurance thing, a licensed EEF would actually assist someone in showing them the options we have on our marketplace, which is Nevada Health Link, and would actually also help them enroll in that coverage. So that's what we're asking for, not just simply asking, do you have health insurance or would you like health insurance? We want them to do the full service of, well, if you don't have health insurance, would you like for me to help you see what your options are? And should the consumer say, yes, I'd like to do that, then you would, that person would then help them enroll them completely through the process and help them select a plan that the consumer chooses. So are you saying we just assist in giving them information, but not enrolling, because they do not have to have any type of, since EEFs do not get commissions, they don't have to have any type of appointments with the carriers, but they will get an EEF license through the DOI that allows them to assist the consumer directly to participate and select a plan.
Okay, so could they be both though? Because it seems like that one slide showed basically you don't want brokers necessarily if they are tied. It's like, no, they just want compensation one or the other.
Well, let me clarify that. It's just that in order for you to be an EEF, you can't have both licenses. You can't have an EEF license and a broker license. So you can only have one. If you are a broker and think, hey, you know what, this opportunity seems better for me, you can do that. But you'd have to sever your contracts with the carriers, as well as render or turn in your voluntarily surrender your license as a producer, broker, or agent to the DOI. And then you would take the EEF license. That does not require you to have any type of appointments with the carriers, because you do not get commissions as an EEF.
Okay, and is that always, are they supposed to always be in person because it's wanting to be more community based, or is it sometimes phone calls? Is that, I don't know what the exact help, if there's stuff that gets directed via phone calls sometimes or video chat.
Yes, we are looking at both options as well. And, when COVID happened, it really opened up the technology for many of our communities. So we understand not everybody will be able to be in person. We'd like to provide that in-person assistance, but if a consumer is in a rural area and cannot make it to your location, you can provide service virtually as well.
Okay, thank you.
Or via the phone.
Okay, thanks.
Thank you, Rosie. So a couple more from the chat and we'll go back. Let's see. Currently, our organization has EEFs, but some of them are part-time. Can we apply for this grant for these part-time EEFs?
Yes, to answer that question, yes.
For the cover sheet, there is a question regarding our program location. Should we answer this based on the location of our team or all the locations where our services are provided?
I think we would want to know where the services are being provided, because we want to know what consumers you are assisting throughout the state and what counties or cities you're currently serving. So that's, I believe, what we meant by where you're located at.
I'll go ahead and pass it over to Terry Chandler.
Hi all. Hey Rosa, it's Terry from Future Smiles.
Hi.
I'm still working with Natalie to try to figure out our budget for our people. I know you're very familiar with our program. I don't want to absorb the time with this webinar for everyone, but for existing organizations that already have EEFs that have been doing this work, and their work kind of ebbs and flows into different ways of contacting either Medicaid enrolled folks or folks that have rolled off of Medicaid or folks that were not insured and may not even be eligible. Like, how do we divide that time up? Because we have resources to identify people, but I'm still trying to figure out are they 50% or are they 100% of their time? Can you help me with that?
Sure. So with this program in itself, we're really looking at, widening the Medicaid assistance as well. So if you are helping with Medicaid assistance, whether it be enrollment or simply showing them the options that they have, work requirements, community engagement, this program is what will help you in regards as to, you don't have to now differentiate between it's Medicaid or it's a qualified health plan on Nevada Health Link. This will encompass all of it now.
Okay, and then the other thing that happens with us, our families are so low income, for the most part, they're not eligible for anything on your Battleborn marketplace. Does that impact us at all?
No, because you're still helping them enroll with Medicaid.
Okay, would you advise that we look at either 50% to 75% of their time then?
So It gets a little complicated when we do less than the 5 and then we do a 0.75, because what we're trying to do is really fund a one full-time person at 100% of this. For example, you have Natalie and you also have Gaia there. So with both of them, for example, if you were to use both of them and they were to both do 50 and 50, that would be great for us as well. If you would submit an application and should you be awarded. So you would really have the complete package there. But if you wanted to do just one person at 0.5, we can understand that. When it gets above 0.5 and not the full 1%, then we're taking now at 0.75. Then I have now 0.25% funding left to see where is that funding going to go and what other organization may be asking for some. So that's when it gets a little bit more complicated for us. But at the end of the day, Terry, please submit what you think you can do. And when we do our negotiations, when we're looking at the budgets that you're submitting, we can communicate with you and see what we can do at the when we see your actual budget in person.
And
Okay, great.
thank you
Thanks.
so much,
Thank you,
Rosa,
Terry.
for that that clarification. The one thing that I do want to stress though is also, like, this is an RFA process. So if everybody who is planning to attend, just, submit within your budget narratives, what you're requesting to support the program goals that you're listing for the program. And again, this will be, a competitive process. And so we will have an evaluation committee. And so if the evaluation committee identifies, your proposal is one that we will move forward with, but we have some questions, there will be opportunities to clarify. So for now, as everybody's just going through, because I'm seeing, we're getting some pretty specific questions here, and as well as online, just go ahead and submit it to the best of your ability and to the best of, what you think that you would need to accomplish the goals that you're proposing in your request.
Thank you, Jen. I think we have a couple quick ones on the chat, and then I'll go over to Shui. How much should we budget for the Nevada insurance certification testing?
Rosa, do you mind
Want me to
sharing
take
the
that?
high-level estimate? Yeah.
Sure. The training approximately is about $500 per EEF, and that's also reimbursable.
Then a couple about fringe rate. Do we have to use our 15% for the fringe rate, or can we use our actual organization's fringe rate? And then Jessica said, same question about the fringe. Our fringe rate is 30% for a FTE. Can that be written into the budget?
Joseph,
Yes.
do you want me to?
The fringe, I was just going to say the fringe can be included in the budget. Does that answer your question?
And we can still submit if we need more in depth. Shui, if you want to go ahead.
Yes, can you hear me?
Yes, Shui.
Okay, I'm helping Faiz, who is our senior director, to ask some question. So she wonders, for the EEF program, we regularly report to Rosa, you. So we wonder for this Medicaid grant, we wonder who are we supposed to report it to, like monthly or regularly?
Thanks, Shui. So anybody awarded through this new grant opportunity, we would request a monthly report along with your requests for reimbursement, similar to, I believe, our other grant opportunities. And I believe we're going to ask, those to be submitted to the same email that's shared here, navigatorsupport@nvha.nv.gov.
Okay, understand. We will do that if we got the grant opportunity, definitely. And then the second question is, she's asking to compare with the EEF program. It sounds like this grant opportunity is highly only focused on the Medicaid. So do you also expect the full-time health navigator to do like Medicaid, not only the enrollment services, but also like an outreach and education as well?
You want to take that, Rosa?
Sure. Shui, you're speaking about this new RFA grant, correct?
Yes, the
Okay.
new rule. Yes.
This new RFA program is really the same thing that you're doing right now as a Navigator grantee. We right now help with Medicaid, QHPs, BBSPs. The new one will do the same. The real difference is the outreach. This RFA will not necessarily have their EEFs attending the outreach events that we attend currently right now. I don't want to confuse anyone on the line, but we do have some current navigators, and so they're asking questions. But right now, with our current Navigator program, we host mini community outreach events. This RFA grant that we are seeking for right now will not have you, the new EEFs, as our outreach staff. You may do some outreach that is more Medicaid based or specific, but you will not be the primary event staff for our outreach. We already have that covered. We just want you to help us with Medicaid questions, work requirements, community engagement, BBSPs, and any plans on Nevada Health Link. I hope that answers the distinction.
When you're saying, okay, I see, understand. So because when you mentioned about the community engagement or answering the question to the community member regarding the eligibility or enrollment services, so those are get through from our regular community outreach, but not assigning by the Nevada Health Link outreach, right?
Can you repeat that again for me, Shui, please? I apologize.
Yeah, no, it's, I mean, I'm confused too, sorry. So when you're talking about the outreach, when we are doing Medicaid Q&A or answering the question to the community member, those activity only through by the organization outreach, but not the Nevada Health Link outreach, right?
So I'll just try and clarify it for you specifically, please, everyone that's on the line. This is more directly to, again, our current Navigator organization, just so that there's no confusions, and any current navigators right now. Right now, you receive monthly emails from Griselda and say, hey, we have these community outreach events. That will continue with our current navigators. The new program, this new RFA, will not receive those emails, so they will not be our event staff for outreach events. They may do their outreach events on their own if they'd like, or if there's a specific Medicaid or BBSP outreach that we feel may benefit them, we may ask them. That's the new RFA or the new EEFs. Does that help you make the difference, Shuyi?
Yes.
And if
yes.
not, we can definitely speak offline over that. I know there may be a little bit of confusion with our current Navigator program and with what we're doing because it's very similar.
Okay, yeah, no problem. I can talk to you later after the meeting as well. Thank you so much, Rosa.
Thank you, Shui.
Thank you. And I just want to remind everybody that we are going to also answer all these questions in writing and have them posted to our website by the end of day on the 19th. So I might skip over some more in-depth ones. Just a heads up on that, and I will go ahead and pass it over to Maribel, sorry if I butchered your name.
Thank you. This is Maribel of Restoration and Recovery Foundation, and my question would be is what would be considered a reasonable average salary for a licensed EEF?
Joseph, do you want me to help with that?
Sure. And I think, you go ahead, Rosa. Go ahead.
Can you just submit what you feel is reasonable? And when we receive those applications, we can review them. Should there be a question or anything that we have, we will contact you directly.
Again, the only reason I ask is because we will be new to this and I want to be fair.
No, I completely understand. And thank you for that.
Thank you.
One of the things too we can do is in our FAQs and in our writing, we can provide average salary ranges from this existing program to help provide some guidance. I recognize that question is coming up quite a bit. So that may be helpful. And then with the fringe rates, if you have an organization that has a fringe rate that is different than 15, go ahead and build that into your budget, but we will need some verification of where or how you guys are at that fringe rate. So.
Thank you, Jen. A couple of quick ones in the chat. This one from Joy. Are the existing grantees in a more advantageous position due to experience?
The short and sweet answer would be no. This is a competitive application process. Again, we are looking to increase the number of in-person education and assister positions in community-based organizations throughout the state. We do have a separate grant opportunity, which we call the Navigator Grant Program, which primarily assists with outreach, education, and enrollment assistance related to Nevada Health Link specifically. This is separate and due to the fact that these in-person assisters would not solely be helping with community outreach events for Nevada Health Link. We're really looking for this more in-person assistance related not only to Nevada Health Link, but also Nevada Medicaid. As many of you know, federal rules are changing and related to Medicaid eligibility, and there's projected to be many consumers in Nevada who will be facing new community engagement and work-related requirements. So really, we're looking at this funding opportunity as a resource for those consumers who are going to be navigating those new requirements for Medicaid, to really help them with this in-person education and assistance to hopefully remain eligible for Medicaid. And if they're no longer eligible for Medicaid, finding other options as far as coverage goes. Hope that answers your question.
You and just one more there is more in the chat, but I'll do one more in the chat, then I'll go over to the hands up. Is the state exam and training in person?
Rosa, please go ahead.
The state exam is in person, that you'd have to go to a specific location. The online training, it's a webinar, so it's online, but you will need someone to proctor it, and it'll give you all that information as well.
Rosie, and I'll pass it over to Terry.
Thanks. Joseph, I wanted to know, for the monthly reporting, will you all give us some sort of a matrix that you want filled out? Or will we be able to create our own monthly reporting based upon the metrics that have been identified in the RFA?
Thanks for the question, Terry. I think we didn't really talk about what we're going to do after the awards as much as just trying to get through the application process, but it's a great question. We're actually in the process of creating a monthly reporting template that we would provide to any agency that's awarded these grant funds. So don't worry about creating anything yourself. We're going to try to create that on your behalf and provide you with the template that we would expect you to fill out each month.
Joseph, the RFA mentions reimbursement. What is the average time frame for receiving payment after a monthly report and invoice are submitted?
I think we have our fiscal staff on this call. Jonathan or May, do you want to take that?
Yeah, hi there, this is Maybelline. Based on this new program, you will be provided with a certain reimbursement form. And along with that form, you'll provide supporting documentation. Once we receive that, Rosa will review and approve. If she has any questions, she'll reach out to you. Once we get that approval from her, we get it back, the fiscal team, and it usually takes about a day for us to process. As long as you're registered with the state as a vendor, and we'll provide more information as that comes to fruition for you. I would say that it takes a couple of business days for the funds to be deposited into your account for that reimbursement. And we do ask that the forms are submitted no later than the 15th of the following month, if that makes sense.
Thank you,
May, I'm just going to jump in a little bit right here also and just add, just so that you're aware, it could take up to 30 days, but usually will take within a couple of weeks from us receiving the request. The main hard deadline is the 15th. You have the 15th of the month to send in those reports, and then finance and I will do the review process. But it can take up to 30 days just so that no one gets thinks that within a couple of days they'll receive all their funding. I just want to make sure we give ourselves some grace.
Thank you, Rosa. Is there somewhere within the application package addressing min/max funding request per applicant?
There is not. When we created this request for applications, we really had no idea, still do not have an idea of how many organizations would be interested and or apply and the amount of funding that they would be requesting. So really, we didn't want to put a limit on the minimum or maximum amounts. Apologies for that lack of guidance there, but really, as stated by our administrator earlier, just please put together whatever budget you think you would be able to implement. And then, we would take that back, review, take it to our evaluation committee who will be scoring these applications. And ultimately, the way that the legislation was written that approved this funding, our department has to provide a ranked list of who we would like to award. And then it's ultimately up to the legislature to review and approve that. So really any of the amount of the award will be, final after the legislature's review. Hope that gives a little bit more context.
Thank you, Joseph. Next one is, do you have targeted guidance on what compensation could be offered?
Can you clarify that question, whoever asked?
Jim B, if you want to come off mute.
And if this is related to what a typical salary would be, as stated earlier, we will ensure that we share, maybe a salary range in our FAQ document or questions and answers document that we're going to post next week on the website, just so you all have an idea of what the range might be. Ultimately, it is up to your agency to include that in your budget plan.
Yeah, and the rest of the questions kind of get into salary and some other more specific questions. So we will make sure to answer those on the Q&A and post those by end of day on the 19th. But does anybody have any other questions? You can either raise your hand or just come off mute.
Hey, Katie, I will address one that I know was asking about the formatting. We do have formatting instructions on page 8 of the RFA, and we'll make sure we post it as well in the Q&A, but it is on page 8 of the RFA.
Tony, go ahead.
Hi there. Sorry if this was addressed. I was just wondering about whether or not there's any requirement for them to be considered full-time salaried staff members, or if independent contractors can be considered to become EEFs.
Do you want to take that, Rose?
Yes, quick question. As an independent contractor, do you work already with an agency? Is this your own agency?
Oh, no, sorry. I'm speaking on behalf of the organization that would be applying, that has some independent contractors already employed who would be perfectly positioned for this kind of training. But I wasn't sure if there was a stipulation from the grant side.
None. It does not preclude any independent contractors from applying or being EEFs. Yes.
So that would just depend on how the organization itself wanted to handle their staff. Okay, thank you.
Correct. You're welcome.
Just had another question in the chat. Are there mandatory minimum numbers of clients served annually?
The answer would be no. There's no minimum requirement of clients that you would have to serve annually. But we would want you to regularly report that out as part of your monthly report on, the number of consumers that you had encounters with, number of enrollments you had, etc. So those will be some items that we will be asking agencies provide us.
Gina, go ahead.
I had questions on the reporting and the heavy lift of like a large agency, like a school district that services an entire county. and what the outreach would look like that. And in my mind, I would like to see a position that creates a website, does the community engagement and pop-ups that we do, has helps our school site staff. Obviously, we can't be at every single school site with one person, but that's how I was looking at it working. But obviously posting the job, getting the position, onboarding them, getting them the equipment up and running, licensed, and all of that is going to be a long time before you actually see results of the work. And with a 1-year grant, if I wanted them to build a website and do the community engagement, I'm not going to see the fruits of these labors right away. So if we're submitting monthly reports, the reimbursement is not going to be contingent upon success, right? I guess is in numbers wise.
And Jennifer, I don't know if you want to take a stab at that at all, but in my mind, it sounds which is helpful. You're trying to focus on, kind of community engagement and outreach, where I think we are wanting to focus more on just the in-person or enrollment assistance in education. What you're kind of outlining to me is kind of more in line with what our other Navigator grant focuses on, which is really just the community engagement and outreach events, where I feel like this grant purpose is more focused on having a person that's in a community-based setting where consumers are already going for other services. It might be medical services, it might be, a food bank where they're going for food or other resources, where consumers are already going, where a person is then trained to provide this enrollment and education assistance. So it sounds a little bit different than what you're kind of outlining in your.
Joseph, I'd like to just add a little bit more also for context. We know that some of these agencies will start off with someone brand new, not licensed EEFs, and that is fine. In order for you to get licensed, it's a process that can take anywhere between 2 weeks to no more than 30 days. So what we are hoping for is that, yes, we understand agencies may start off with no EEFs, but they're basically in training. But if you are more than 30 days without someone already in place or getting the training done, then we'd have to review the process, because what we'd like to do is make sure that the funding is being used adequately and correctly. But if it's going to be something very difficult for an agency to hire someone that's going to take maybe 4 or 5 months, maybe then that's a conversation that we'll need to have up front as well.
Thank you, guys. One more question in the chat. I have an employee whom I would write into this grant at 75% of her time. Is that allowable for me to do so? Or do I have to have at least one full-time EEF worker on the budget? Also, can an EEF supervisor / second employee be written into this as well at 25% of their work hours, or is the minimum 0.5 for every employee on the budget?
And I guess I'll clarify that we didn't include really a minimum or a maximum within the RFA. Ideally, we would, it'd be great to have a full-time position dedicated to this work, but completely understand if your proposal needs to include less than 100% FTE. We would just want to ensure that any activities that you're wanting to receive funding for would be helping consumers with enrollment and education activities. You mentioned a supervisor position. So just for clarification, if this person would just be supervising an EEF, I don't think that person would then be eligible for reimbursement through this grant. We would want to reimburse any salaries that are specifically dedicated to the enrollment and education activities.
Thank you, Joseph. I'm not seeing any other questions. If anybody else has any more questions, if you could raise your hand or put it in the chat. I think we're good, Joseph.
Thank you, Katie. Appreciate your
Thank
help.
you, Katie.
I just wanted to say thank you all for your time this afternoon. I know this was a long meeting, but hopefully it was informational for you. Really appreciate your interest in this funding opportunity. Also can appreciate the tight timeline that we have, but really look forward to seeing some well thought out proposals and applications. We did include, the email here. Please send us any questions that you have following today's workshop. This should be recorded and posted on our website as well if you ever need to review it in the future, and look forward to seeing your applications. Thank you, everyone.